Thanks so much for watching Making Healthcare Work for You, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we welcome Sanjay Doddamani, who is the founder and CEO of Guidehealth, and Michael Gleeson, who is the co-founder and Chief Growth and Technology Officer. Thank you both for being here. So Michael, can you tell us, how does the Guidehealth model support the patient journey?
Yeah, of course. So the model itself is built on a technology platform, and that technology platform supports the patient journey in both targeting the patient. So how do we get the patient? How do we figure out who the right patient is, who we should be engaging, talking to? How do we determine what the right interventions and programs are for those patients? And then how do we generate outcomes for those patients and get them into these programs? And we've built a platform to support this that starts with how we aggregate data. So we start with data that makes a difference initially to targeting and only use what we need to get moving quickly. Too many patients get missed or lost in their healthcare journey because you did not, a system didn't address them soon enough or fast enough. Our approach to data allows us to do that really quickly. We then target those patients that have the most modifiable risk and are aligned with the high impact interventions that we're running across our health system partners. Then we build unified care plans for those patients where we're determining what the right engagement pattern is, what the right approach is, what the right interventions are in more detail. And then we have a model that allows us to universally engage the population and create a feedback loop back into these overall processes where we can target the patient for their next action based on their intervention, or if our models are connecting with those patients, we can find things that are happening in their lives that may suggest that they should be rolled back into these other programs. And then we monitor and maintain all of that through a performance management platform that allows us to keep an eye on what's going on with those patients and how their health is progressing.
That's incredible. It sounds like such a comprehensive approach that also alleviates burden from the physicians from having to keep track of all of that. You guys have such a seamless way of doing that. That's incredible.
That's exactly right.
And Sanjay, with this incredible growth, how are you funding all of the plans?
That's a great question. We really are stretching the dollar for all the work we're doing. But truth be told, Guide Health at where it's at in terms of high growth and the need for us to make strategic investments to expand our work in quality and value-based care initiatives, especially with our health system customers, has necessarily necessitated, investments of capital. We just received a $10 million strategic investment from Emory Healthcare. Really proud of that because this is the second time a customer, specifically a health system, has invested into the growth of our company. So lots to see of how we then, use that to support our platform growth, continue to offer our AI-powered solutions, and especially build out the rest of the infrastructure for the company. It's certainly an exciting time for us.
That's amazing. I love hearing it. Thank you so much. Thank you all for watching. We'll talk to you soon. Bye-bye.